Acute and chronic inflammation are two distinct types of inflammatory responses in the body. While both are part of the body's immune response to injury or infection, they differ in their duration, cellular components involved, and underlying mechanisms. Here are the key differences between acute and chronic inflammation. Duration. Acute inflammation is a short-term response that typically lasts for a few days to a few weeks, depending on the severity of the injury or infection. In contrast, chronic inflammation is a prolonged response that persists for weeks, months, or even years. Cellular infiltration. Acute inflammation involves the rapid infiltration of immune cells, primarily neutrophils, into the affected tissues. Neutrophils are the first responders and play a crucial role in combating infections and removing damaged tissues. In chronic inflammation, there is a persistent infiltration of different immune cells, including lymphocytes, macrophages, and plasma cells, which contribute to tissue damage and remodeling. Tissue destruction and repair. Acute inflammation is generally characterized by self-limiting tissue damage and subsequent repair. The inflammatory response helps clear the initial insult and initiate the healing process. In chronic inflammation, the tissue damage is more sustained, and the repair process becomes disrupted, leading to progressive destruction of healthy tissues. Inflammatory mediators. Acute inflammation involves the release of pro-inflammatory mediators, such as histamine, bradykinin, and prostaglandins, which cause vasodilation, increased vascular permeability, and pain. These mediators are primarily responsible for the characteristic signs of acute inflammation, such as redness, heat, swelling, and pain. In chronic inflammation, there is a persistent release of pro-inflammatory cytokines, such as tumor necrosis factor alpha, TNF-alpha, and interleukin-1, IL-1, which perpetuate the inflammatory response. Underlying causes. Acute inflammation is typically triggered by infections, tissue injuries, burns, or acute illnesses. It is a normal and essential response of the immune system. Chronic inflammation, on the other hand, often arises from persistent infections, autoimmune disorders, prolonged exposure to irritants, e.g., cigarette smoke, or unresolved acute inflammation. It can also be associated with conditions like rheumatoid arthritis, inflammatory bowel disease, or atherosclerosis. Acute inflammation is a rapid and short-term immune response that occurs in response to tissue injury, infection, or exposure to harmful substances. It is a protective mechanism that aims to eliminate the initial cause of injury or infection and initiate the healing process. Here's an overview of acute inflammation, including its definition, related diseases, diagnosis, causes, symptoms, and treatments. Definition. Acute inflammation is a localized response characterized by the dilation of blood vessels, increased vascular permeability, and migration of immune cells to the site of injury or infection. The purpose of acute inflammation is to deliver immune cells and plasma proteins to the affected area, remove debris, and facilitate tissue repair. Related diseases. Acute inflammation can occur in various conditions, including infections. Bacterial, viral, or fungal infections can trigger acute inflammation. For example, acute bronchitis, appendicitis, or urinary tract infections often involve an acute inflammatory response. Injuries. Tissue damage caused by trauma, burns, cuts, or fractures can lead to acute inflammation. Allergic reactions. Allergens, such as pollen, pet dander, or certain foods, can induce acute inflammation in individuals with allergies. Autoimmune diseases. In some autoimmune disorders, the immune system mistakenly attacks healthy tissues, leading to acute inflammation. Examples include acute flare-ups in rheumatoid arthritis or systemic lupus erythematosus. Diagnosis. Diagnosing acute inflammation typically involves a thorough physical examination, evaluation of medical history, and assessment of presenting symptoms. Additional diagnostic tests, such as blood tests, e.g., complete blood count, C-reactive protein, imaging studies, e.g., X-rays, ultrasound, or tissue biopsies, may be conducted to identify the underlying cause or assess the severity of the inflammation. Causes. Acute inflammation can be caused by various factors, including infections. Bacterial, viral, fungal, or parasitic infections can trigger an immune response. Tissue injury. Trauma, burns, cuts, surgery, or physical agents, e.g., radiation, can lead to acute inflammation. Foreign substances. Exposure to toxic chemicals, allergens, or irritants can induce an acute inflammatory response. Symptoms. The classic symptoms of acute inflammation include 1. redness, rubor, and warmth, calor, in the affected area. 2. Swelling, tumor, due to increased vascular permeability and fluid accumulation. 3. Pain, dolor, caused by the release of inflammatory mediators and tissue damage. 4. Loss of function, punctio-laesa, due to impaired tissue function or mobility. Treatments. Treatment options for acute inflammation depend on the underlying cause and may include rest and protection. Resting the affected area and protecting it from further injury or infection can aid in healing. Cold therapy. Applying ice or cold packs to the inflamed area can help reduce pain and swelling. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or aspirin, can alleviate pain and reduce inflammation. In some cases, corticosteroids may be prescribed to suppress the immune response. Antibiotics or antiviral drugs. If the underlying cause is a bacterial or viral infection, appropriate antimicrobial medications may be prescribed. Management of underlying conditions. Treating the underlying disease or condition that triggered the acute inflammation is essential to resolve the inflammation completely.